Hello, I'm Philip Jackson-Taft, lead nurse at OH1. Welcome to this first presentation in our series of webinars looking at the health difficulties of the working population and new ways to think about the management of health symptoms. At OH1 we specialise in supporting businesses and people with health difficulties. I have the privilege of working with our team of clinical experts, including our lead occupational health consultant, Dr. David Batman. Dr. Batman is a vastly experienced physician and a world-renowned expert in health needs, health behaviours and resilience. These webinars will provide access to Dr. Batman's expertise and will offer advice that anybody and everybody can benefit from. The COVID-19 pandemic has changed the way that we all live and we all work. We have made these first two sessions to provide people with expert guidance through the current upheaval. Although COVID-19 has made many of us feel overwhelmed and powerless, it has actually never been more important to take control of our own health and well-being. In this first section, Dr. Batman looks at the pandemic in the wider context of health and the health challenges facing the population. Thanks again for watching. Now it's over to Dr. Batman.
Welcome to this recording by OH1, your partner in health. My name's Dr. David Batman. I'm a consultant occupational health physician. That means that my specialty is not just general medicine, but it's actually interrelating with businesses and employees at work. I've been a specialist in occupational health now for over 30 years, and I specialise in mental health at work, resettlement, risk assessments, etc. As part of my career, I spent 20 years as head of occupational health and safety with Nestle throughout the United Kingdom and Ireland. During that time, I was instrumental in helping them as a business and other businesses that I worked for, getting through the SARS epidemic, getting through the MERS epidemic, H1N1 avian flu. So I've got a lot of expertise in all the areas we're talking about. I also, as part of the work that I do, I'm a member of the Virgin Pulse Science Advisory Board, and I advise them as a worldwide business. Now today, what we're actually going to talk about is helping you, your businesses and yourselves through a difficult period of disruption and uncertainty. In all my 47 years practicing medicine, I've never been faced by such a difficult situation as we find ourselves, all of ourselves in across the world, not just this country, in terms of COVID-19. It's caused disruption at all levels and will continue to do so. So this aim today is just to take you through that, a bit of understanding. I'm not going to spend a lot of time dwelling actually on the virus itself, but more giving you help and techniques as to why you're feeling this way and how we can help you and you help others, either in your business, in your family, in your community, get through this. Now, over my last probably 20 years in medicine, there are two big threats that I've had to deal with. The first was obesity, and we've known about this for 20 odd years now. You don't need to be a doctor to actually diagnose obesity, you can see it. And it's really strange that when we look at this and a number of the lifestyle issues, 70% of your risk, if not a bit higher, of becoming ill is around lifestyle, how you exercise, how you sleep, how you eat, how you move, how you drink, etc. And we know obesity is linked to a lifestyle. And unfortunately, it's linked to other heart disease, lung diseases, cancers, etc. And particularly with COVID-19, it's the obesity which actually becoming a major risk factor. So we've been dealing with obesity, but not very successfully, unfortunately, because it requires you and everybody else to change their behaviours. Now, over the last 10 years, mental health has become the big one. We've started to destigmatise it. People are more open, more honest, and businesses are, etc. So I've already been dealing with these as threats to health. And it's part of myself and my colleagues, a daily life that we help you as individuals and businesses through the process of getting used to it and managing these situations. So why am I going to talk mainly about mental health today and not particularly about physical health? Well, I'm going to go back to the last 10 to 12 years I've been dealing with it. And when we look at it, prior to this current pandemic, almost 1 in 5 people would have a mental health problem at any one point in time. So every day, every week, about 25% of any organisation had a problem. And 1 in 3 of us will have a major mental health illness over our lifetime. Now, most of the common issues and causes up until recently were about lack of trust, uncertainty, marital problems, finance, disruption, children, etc. And two things were happening. At that stage, and it's only very recent, it was the elephant in the room. People really didn't want to talk, even at very senior levels in the business, about mental health. It was something you couldn't see, you couldn't touch. There was a fear about it. And indeed, employees didn't want to come forth about it at the same time. So even with that 20% of the population with it at work, it really only was the tip of the iceberg. And we weren't seeing a lot of those cases because people didn't want to declare it. They felt guilty, they felt a sense of fear, a sense that there was something wrong with them. So this was the backdrop about what was happening before COVID-19 came along. COVID-19, it's a viral illness, as you know, through the pandemic striking across the world, has actually created levels of mental health problems, anxiety in everybody. This isn't limited to 20% of the population. Everybody that I talk about, from adults up and probably from mid-teens onwards, has got this level of anxiety. And what's creating it? It's a fear of the unknown. It's the uncertainty. The media's not helping because it's all doom and gloom, and it's giving us too many choices. But I'm very clear, both from a medical point of view, a doctor's point of view, and a science point of view. We need to understand the science behind this virus, behind the pandemic, in order to make information and judgments. And I'm hoping, as part and parcel of this presentation, that you'll get some sort of foundation that you can trust and rely on as we go forward. The first thing I would say is you are not out of kilter with everybody else. It's not just you that it's affecting in terms of fear and anxiety. It's everybody. You are not alone. But I'd also say, as much as the media is bad, and it's horrible that people are dying, and it's not good, and it's not just at-risk people. People of all ages are susceptible. The vast majority of us will get through this. You will get through it. You may have a mild to moderate illness. You may have it and not know you've got it. You may have any symptoms. You may get it severely. But at the end of the day, we will get through it. It's going to be a different world, and I don't know when that world we will get through into the other side, but we will. So I want to give you some hope and something that you can take forward. So just one slide on the background to COVID-19. COVID-19 is part of a group called the coronaviruses. Coronaviruses cause things like the common cold. They cause influenza that we get every year, etc. So it's been going on for years. It's just that this virus is a different thread of the main field of the coronaviruses, and it's more severe, it's more mobile, it's more infectious than the other ones, and it's sort of caught everybody's surprise. We're still not sure where it came from, but it does believe that it came from a transmission from animal to man somewhere in China. We may never know, but that's the most likely thing. It's known as COVID-19 because it's a coronavirus. It's a new virus, and 19 because it was first discovered in 2019. It is more contagious than the common cold, and the symptoms are very different. The common cold tends to start with a bit of an itchy eyes, a bit of itchy nose, maybe a sore throat, and then a mild cough, and then maybe a bit of phlegm, etc. This invariably starts, and you may be shedding the virus without knowing it, without symptoms, but then it tends to start with a fairly high fever. You feel generally unwell, aching, etc. Then you get this deep hacking cough. Now, for most people, that tends to last about 7 days. Then people tend to come out of it, like you would do flu, but you may feel like you've been hit with a train because of the muscle aches and pains that you get. But then a small percentage go on to have these severe illnesses, pneumonia, and the lung problems that require going to hospital. It seems to be that what we're finding now as we go into it, and there's a lot of research going on, and I read a lot, and I talk to people, and I listen to a lot of webinars myself, it affects primarily males. 2/3 of the problems of the severe case of the deaths are in males. Women seem to have a better immune system. We think the immune system is based on the X chromosome. Women have 2 X chromosomes, as sex chromosomes. Men, we just have 1 X and a Y. So women may be a little bit more protected. Women tend to smoke less. They tend to have better diets. They tend to exercise more. They tend to be less obese than us males, etc. Obesity is a risk factor. It's a risk factor because if you are in hospital and you've got that weight pressing on your chest and your lungs can't expand, then it can go onto a pneumonia. Smokers doesn't seem to be a risk factor as we thought it would be. And ethnic minorities, for some reason that we do not understand, tend to be a risk at the same time. Now, I will say at this moment in time, there are lots of trials going on, but we don't have a medical treatment for it. There isn't a drug that we know specifically. There's a lot of trials going on, some interest, but no specific one at the moment, and we don't have a vaccine. There are a lot of people working on vaccines. They will get a vaccine, but in terms of when it's ready, because you have to go through a lot of safety checks, the vaccine, once it is ready and tested, probably won't be into mass production until the middle of 2021. So it's not easy. So what we need to do, what I need to do, what you need to do is to make sure that we isolate so that we're not touching one another, we're 6 foot apart, etc. So distance is important, etc. If you get symptoms, make sure you isolate, the contacts isolate. Wash your hands. This virus is really susceptible to washing of hands, to soap and to warm water. And a simple detergent, just your household detergents that you've got, the domestics of this world, diluted 50 to 1 in ordinary water, will very quickly kill the virus within a minute or so, etc. So it is an important one. We want to stop the spread of people. We want to stop death. But most importantly, we want to stop the pressure on our health service. Our health service is doing a phenomenal job. They really do, but they're under difficult pressures. And the more people we can keep out of hospital, the better. The other thing is, if we don't keep people out of hospital, people with the ordinary illnesses, the heart attacks, the strokes, the accidents on the roads, clearly the hospitals are swamped with doctors involved with people with coronavirus, and there are less resources. So anything you can do to prevent yourself becoming ill or an accident will help as well at the same time. So that's just a background. I think there are some threats that I've looked at, the threats that are going to come with the virus, and I've just linked these. There's obviously that threat to life that I've just talked about. Even when people survive, those who've had serious illnesses, those who've been into hospital, those who've been into isolation, those who've been on ventilators, been in intensive care, we do believe that there's going to be a problem in terms of long-term mental health and physical health. Every day that those people are on a ventilator in a hospital bed in intensive care, they're losing something like 3% of their muscle bulk. So you're not going to be as strong, you're going to be fatigued when you come up. And that fatigue can last between 1 and 5 years. Obviously, we're having problems and the health service is coping, but only just coping with the flood of new cases. And as you know, we're setting up some really big Nightingale hospitals, big warded hospitals to look after those people there, to keep them out of there. But I've said there may be deaths from treatable illnesses because there isn't the same space or expertise to treat them in hospitals. There's obviously, having seen the doctors and the nurses and the other carers and the paramedics and the firemen and police dealing with this horrible situation that they are dealing with, and they are fearful of their lives. My wife and I have been either in nursing from my wife's point of view and me from a medical point of view, between us for about 100 years collectively, 50 years each. We've never gone to work fearing that we may never see each other or our children when we came home at night, etc., or wouldn't come home. And there's a real fear that the doctors and nurses are actually going to succumb to the virus, because clearly there's a huge concentration there. So that's going to have a long-term effect on them as well. Obviously, fear and uncertainty among us all. No matter where you go, there's a look of fear on people's faces, etc. We no longer talk to one another face to face. We distance ourselves. We don't shake hands. I suspect the handshake as a method of greeting has now disappeared. Even when this virus dies down, and it will take a while to die down, we're going to have to social isolate, probably for months, if not 18 months ahead of time. So that's going to change. You're all being forced into isolation. You're all being forced into what is normally just a Christmas vacation, an Easter vacation, maybe a 2-week holiday. But then you're used to going back to your normal lives. You're used to having personal space. That's changed. So relationships will be strained. You're all home teaching those who've got children. Children are frightened. They can't go out. They can't see the friends. They can't exercise, etc. There's going to be a strain there. And clearly, one of the things we're worried about now, and those of you in business and owning businesses and working business, the longer this goes on with isolation, the impact socially and economically is getting greater. And obviously, getting back to work is important for personal finance, business finance, the country and the world, etc. But we've got to do it carefully, because if we let up on the social isolation, the distancing and the hand washing too soon, we'll get a second wave. That's going to have an effect, certainly on long-term health issues and poverty and inequality. So that's going to have an impact long-term as well. Are we going to have enough services to manage those people with long-term mental health as they come out of this? I suspect not. We weren't good in the first place, so that will have to be ramped up to help these people cope. Population growth, strange one. You wonder why I've put that one there. Well, I think at the moment, we don't know the impact of this virus on pregnancy, on particularly the baby that's growing in those first 3 months. We've not met it. What I will say is, though, that we do know that coronaviruses in general don't tend to affect babies' growth, their development at all. There's no reason to think this is difficult, but clearly we're going to have to wait another 6 months or so before we know. And it may well be due to the adversity that we've seen and the shock wave that we've had. More and more couples may be thinking twice about having families going forward. So it could have an impact on population growth. It'll also potentially impact workers. We used to see, or have seen up to now, people in the workforce working past 65, 70. They may well be deciding that they're going to stay at home now and not go back to work. So there's a potential change there. And above all, the world has changed. It will not be the same again. It will be a different world. But it's happened before and it will happen again. Things do change and the new norm may be better. We may be more sociable. We may be more relaxed. We may have learned to deal with less things and spend less. So let's be positive rather than negative as we go out of that. So what are the things that are changing? Well, clearly the world of work has changed. The place of work has changed. You're learning to work from home. I'm amazed that the internet has worked so well, but it has. Team meetings still go on, one-to-one with managers go on. People are still being productive. The world of business hasn't completely stopped. But obviously, when we go back into work, there's going to be an element of worry and fear about meeting colleagues, about touching and distancing. There may well be a mixture of home working, business working. We don't know. I don't know at the moment. Even the most important minds that I've talked about, not sure what the world is going to be like. It will be different, but it will go on. So what else has changed? I've just talked. Relationships have changed. I think one of the relationships that we've known, particularly the older generations, and I include myself there, the fact is I can't go and talk to my children. I'm isolated from them. I'm isolated from my grandchildren, and potentially will be for many, many months to come. That clearly has an impact there. There will be the impact of the elderly among us who used to support you and looking after your children during the week. That may change. So childcare may change at the same time. So more imponderables that have changed. People's attitudes and behaviours have changed an awful lot, but a lot for the better. I see people talking across the street, people are stopping, they're exchanging glances, people are shopping in a different way, little entrepreneurs are picking up every now and again. But I think people's attitudes to one another has changed, to local communities have changed. We're more caring, we're more thoughtful, we're looking after our neighbours, we're looking after our friends. So a lot of positive things that I'm seeing there. Mental health will continue. Fear will become the new norm, as I've said there. Anxiety and depression will continue, but that is treatable. There are two forms of anxiety and depression. One which is just an inherent part of your genetic structure. That's not the one we're talking. We're talking about one which is a reaction to the situation. So as the situation settles down and we get more information and more security, that may well tend to settle down and go away to a extent. Now, I'm also seeing in my clinics and the people I talk to across the world, there are some generational differences about how people are reacting. And certainly from your perspective, you're wondering why you are reacting to this in a certain way. Or if you're a business manager, you wonder why different age groups in your workforce is behaving in different ways. Let's just have a look at the generations and see how that has changed. So if I first of all look at the baby boomers, I'm part of that. People really over the age of mid-50s. We were hard working, motivated, we were workaholics, we were living and working longer, we were carers for our grandchildren and helping there. We wanted to work, but we wanted to work because we enjoyed it. The work may not be there. We may be worried about the work going forward. We can't care for our grandkids. We can't support our children. We're worried about pension. So that age group really has been a dramatic change in their thought processes. And for a lot of us, particularly those 65 and above, we could be isolating in our homes for anything up to another 6 to 9 months yet. So that group is clearly, there's a fear and uncertainty. The age group from mid-30s to mid-50s, this is the group that are finding it hardest to come to the lockdown and the isolation. They were always skeptical of authority. They were challenging. They wanted a work-life balance. They can't get that when they're stuck at home at the moment. They were self-reliant. They were entrepreneurial. They were looking for new jobs, etc., constantly changing jobs. But there again, that generation were having difficulty in finding their own homes, etc., due to the price of mortgage and a lack of wage increases. So we've had 3 generations in there. And we had a lot of those who were actually in work but still poor. So for that group, the world has changed dramatically, and they're challenging this. They've never met anything like a lockdown. They've never had to change their attitudes, behaviours. So they really are reacting quite badly. And this is the group that is really challenging the need for social isolation. Those are the group that if they break free, will end up potentially spreading it more again. Now, the younger age group, the early 20s to the mid 30s, now they have difficult risks here. They were fairly flexible in their schedules. They were confident, they were ambitious, they were ready to move, and they were actually managing change quite nicely. They were good at managing change. They knew redundancy could come along, and they coped with that, and they managed. But there were usually other jobs to go to. We don't know what the job market is going to be like, so they're going to worry. But in terms of the main worry, what concerns me most in what I'm saying was their use of technology, and in particular social media. If we actually look at the media in all its forms, but mainly the technological side and social media, it's doom and gloom. When you switch it on, there's never good news at all. This is creating that real sense of fear in people's minds. And I'll talk about how to manage the situation we're in a minute. But for them, although they are technologically savvy, it's actually working against them. Now, for the younger ones, these are what I call the digital natives. They spend their lives on mobile phones, on their tablets, on their laptops. That's where they have relationships. That's where they get everything. They're immersed into it. So they are now immersed in a world of bad news and gloom and despondency. When I talk and counsel people about mental health and helping them through it, when I mentor them, I always talk to them about not surrounding themselves by people with sort of negative attitudes. That's really hard to do now because they're constantly there in your face. Clearly, children are a problem at the moment, and I think we're all trying to distance them from the world that they are, but they're clearly into now this homeschooling and everything goes there. So what I'm trying to say here is, don't worry if you're behaving different from somebody else you know. If you're a line manager, there are reasons why people are behaving differently. This is part of it. You can't change your makeup, and you can't change your attitudes very quickly as we're having to do at the moment. But across everybody, it doesn't matter what generation you're in. There's this fear of COVID-19. There's a worry about the long-term job and financial security, etc. And we've all got that. It's easy for me to say, don't worry about the worry until it becomes reality. I think at the moment, there's so much reality around at the moment that is completely dominating our lives. So what is the personal impact? What's going on? Now, I've shown a picture of a swan there. And this is usually what I get in periods of people with mental unhealth, or generally when we're into situations like this. And I saw it after 9/11, I saw it with SARS, I saw it with the financial crash. And on the surface, everybody is showing their public face. They're showing their swan personality. On the surface, they look calm and serene. If you've ever seen a swan under the water, those legs are paddling like mad. And that's what's happening to you and everybody else at the moment. Your private face is struggling underneath your public face. And these are just some of the feelings that you may well have. And it's about confusion. You don't know what's going on. You may have panic attacks. You've lost belief and confidence in yourself. You're probably sleeping badly. You're worrying. So you may be getting more time in bed, but your depth of sleep and your quality of sleep will have changed. That leads to changes in concentration and memory. Your appetite goes off at the same time. You may find your heart beating. You may get none of these, you may get one of these, you may get all of them. But in fact, what I'm saying to everybody that's there, you aren't alone. Everybody's feeling that. There are times when I look at the media, when I talk to my children, grandchildren over Skype, etc. I get worried, I get anxious, I feel something. Nobody's immune. But when I say you are not alone, you are not a single swan at this moment in time. You are part of a worldwide flock of swans. Everybody's behaving the same way. And I just advise people to use three simple words when you meet people, or even your partner, your spouse, your kids. Just these simple words that just ask, how are you? Just by asking those 3 words, it will open up a conversation, it will things going. But don't hide your feelings, share your feelings, be honest with people there. You are one of my flock of worldwide swans. It's never been bigger. So we can either go under with this and we can sort of go under with the storm, or we can learn to dance in the rain. But what we do need to learn is going forward is to thrive in this environment, not just only to survive.
So that concludes the first section of this webinar. Thanks for listening. I hope you've learned something from it and that it helps you to live well in this difficult time. If you have any questions or comments, please don't hesitate at all to get in touch with us. Our contact details will be on screen at the end. Thanks again and stay safe.